Is it possible to create a Saiyan medical pod? How do you treat a damaged tailbone? And just how much would it cost to treat all of Vegeta's injuries? Hi guys, and in today's video we're going to be looking at the Namek saga, following on from my video where Goku fought Vegeta. I'm going to be breaking down all of Vegeta's fight injuries, and I'll be calculating how much realistically he'd end up paying on medical bills to get a clean bill of health. So let's throw Vegeta up on the screen, and if you're ready, let's begin.
Go ahead, laugh if you want. I'm about to wipe that stupid smile right off your face.
Okay, of course, with taking multiple blows to the head like this, you've got to be worried about a concussion or some underlying brain injury. There is even a chance of developing something called a subdural hematoma, which I understand is what ended up killing Akira Toriyama. So I'd recommend a CT head scan, looking for any underlying bleeding on the brain, and this is going to come in at a cost of $5,000. Now, on top of this, there is a risk of damaging the supratrochlear veins. Those are the veins that you can see bulging on someone's forehead. And if these rupture, you could end up with quite a significant hematoma that could take several months to go down. Some of you who watch UFC might recognise this lady who had a significant one, almost making her unrecognisable. Now, I'm sure we've all been winded before and having that uncomfortable feeling of not being able to breathe after taking a blow to the tummy. And the reason this occurs is because your diaphragm muscle goes into spasm, making it difficult for you to expand your lungs. And normally you can recover after a few minutes just by focusing in on taking a few deep breaths. However, Vegeta here is taking a knee from one of the most powerful beings in the whole universe, so I think we've got to assume there's going to be a bit more damage. So in cases like this, where there's been blunt force trauma to your abdomen, we actually perform something called a fast scan, which is basically an ultrasound scan that looks at the abdomen and assesses all the organs to see the extent of damage. And if you're going to have to pay for this, you're probably looking at a cost of around $1,000. Okay, so Vegeta's back has had to take the brunt of the force with being pushed through this mountain here. Fortunately, he's wearing his Saiyan armor, but the one area that's a bit more vulnerable and less protected is his tailbone, otherwise known as his coccyx. Now, I know that Saiyans actually have a tail in their normal anatomy, and falling from this height, you've got to be worried about a fracture to this bone. So we'd have to get an x-ray of this area, which is going to come in at a cost of around $250. Now, if a fracture is detected, there's not really much we can do about it other than giving pain relief. And for some of my patients who have a coccyx fracture, unfortunately simple tablet medications isn't enough, and they might actually need injections of stronger painkillers, coming in at a cost of around $250 a piece.
No, I won't lose!
So, taking an uppercut to the chin can certainly rattle the brain and skull, but just how damaging is a move like this going to be? Well, as the jawbone isn't fully fused to the skull, it makes it a vulnerable point to fractures, with the majority of jawbone fractures occurring across the angle of the mandible. Now, if the fracture isn't that bad, then a surgeon might be able to manipulate the bones into alignment under anaesthetic. However, if it's a severe fracture, the surgeon's likely going to need to do some open surgery where he realigns the bones using plates and screws. And this could come in at a cost of anywhere between $10,000 to $15,000. So Vegeta takes several further blows to the face here from Zarbon as he continues to pummel him down. And the concern here would be whether or not he sustained any facial bone fractures. So we'd really need some facial bone x-rays to help assess the damage. And this is going to come in at a cost of around $250. Now I think this is pretty good value for money, because if you just have one fracture, this could be managed quite simply. However, if you've got multiple fractures throughout different facial bones, you're really going to want a referral to a specialist to help reconstruct your face to resemble what it should look like.
It's lights out for you, Vegeta!
Okay, so a high-speed collision with the ground, as we see Vegeta take the brunt of the force on both his head and his neck. Also, it's quite important whether Vegeta had his chin tucked in, or whether he had his head extended as to what fractures he might sustain. For example, if he collides with his head extended, almost facing the ground, he's going to sustain more facial fractures and a fracture of his jawbone. Whereas if he hits the ground with his chin tucked in, the force is likely going to be transmitted to his C-spine, causing fractures to his vertebral column and likely damaging his underlying spinal cord. If that's the case, he may well be paralysed from that level below, needing to remain in a wheelchair for the rest of his days. So I think we're going to need to get a CT scan of his neck, which is going to come in at a cost of around $5,000. I'll throw in a wheelchair and a neck brace, free of charge.
Zarbon, you made your last mistake. All you've done has made me stronger.
So Vegeta's somehow survived this battle with Zarbon, but it looks like he's clinging on to life by a thread. And from what we can see, it does look like he's damaged his supratrochlear vein, as we can see some blood coming out of his head just there. Really, to manage this, he's probably going to need a cold compress to be pressed firmly on that area to help control the swelling, but it doesn't look like he needs any fancy stitch work to stitch up any veins or his skin. And following this scene, I think Zarbon comes back and takes Vegeta back to one of their medical pods to heal all of his injuries. Now, unfortunately, in real life, we don't have medical pods like this, and probably the closest thing you're looking at is one-to-one nursing in the intensive care unit. And unfortunately, that doesn't come cheap, with you looking to pay around $1,500 per night, which in my opinion is actually pretty good value for money, considering the specialists that are involved in your care and all the specialist equipment that's used to keep you alive.
Now this is one of my favorite little moves.
Okay, so a knee to his face, but more specifically, I think he gets hit in the nose here, as we see blood go flying everywhere. Now, taking a knee to the nose can certainly cause a nosebleed, but taking a knee from one of the Ginyu Force, I think we've got to assume that he's fractured his nose. Remember that the majority of the external nose is in fact cartilage, and it's only really the top part that makes up the nasal bone. So although in cases it might be really obvious that the nose is broken, you'd still need an X-ray to determine the severity of the break. And depending on how brave your patient is and the severity of the fracture, you may well be able to realign it just with manipulation alone. However, if it's a more severe fracture or the patient's unable to tolerate the manipulation, then you may have to perform a septorhinoplasty to help realign the nasal bones, and this could come in at a cost of anywhere between $6,000 and $30,000.
I gotta hand it to you, I'm impressed. But let's see if you can bounce back from this one.
So Vegeta there takes an elbow to the top of his skull. But just how easy is it to fracture one of your skull bones? Well, really, it comes down to where you've been hit. For example, the Pterion, where the frontal, parietal, temporal and sphenoidal bones join, is the weakest point on the skull and most vulnerable to fracture. Also, just lying deep to this area runs the middle meningeal artery, and so if you sustain a fracture in this site, it could actually tear this artery, causing bleeding around the brain. Whereas the top of the skull is pretty hard, being composed of compact bone to help protect the brain from external forces. So here, I wouldn't be surprised if Vegeta got away unscathed.
I'm glad you're back, Vegeta.
So, head first into the dirt. I don't really know how any normal person could survive this. But I guess if it's wet sand or soil, there's always a possibility. Now, let's just speculate here and say he did survive this. What kind of injuries might he have sustained? Well, we're probably looking at multiple fractures in the limbs that are below ground, as well as quite severe abrasions to his upper body and face. Now, the best way to assess this is probably performing a skeletal survey, where x-rays are performed on the whole body to help assess what's broken and what's not. And this is going to come in at a cost of around $750.
Yeah. Hey now, what do we have here?
This is just one of those character traits that I love about Vegeta. There's no such thing as a low blow to him, no level he won't stoop to, and no sneak attack that he wouldn't consider. Like faking to be unconscious to try and get a killing blow on Recoome.
Come on, what are you waiting for? Can't you see it's now or never? Now I too will become a Super Saiyan and annihilate Freiza.
You know, initially I thought this idea of getting stronger after every fight was pretty cool. However, seeing that Vegeta's now using this and stooping so low as to get Krillin to attack him makes it seem a little bit silly. But what sort of injury are we seeing here? So we're seeing an energy blast penetrate through his abdomen and come out his back through his vertebral column. This would have likely have perforated his intestines, obliterated his abdominal aorta, and completely pulverized his vertebral bones. And out of these injuries, the one that's likely going to kill him the quickest is probably the damage done to his aorta, as this is carrying the majority of your blood supply at any given time, and you could ultimately bleed out within seconds. There wouldn't really be any way of surviving this kind of injury. So at this point, Vegeta's been hit in the head so many times, you've got to wonder, what else is there to break? Well, we can see plenty of blood flying out of his mouth there, so you've got to wonder, has he lost any of his teeth? Now, if he has lost some teeth and there is adult ones, there's no real way of getting these back, leaving him with one of two options. Either he could go for a false tooth or a denture, which costs around $300, or he could go for a dental implant, which comes in at around 10 times that, around $3,000 a piece. With those prices, let me know what you guys would choose down below.
Vegeta, I must say I'm very disappointed in you.
Okay, so I'm not really 100% sure what Freiza's aiming for when punching him in the back. It's either going to be his vertebral column and his underlying spinal cord, or Vegeta's kidneys, which sit either side of this. And we've got to remember that your skeleton not only offers support for your soft tissues like muscles and tendons, but also acts as a form of body armor to protect your underlying organs. For example, the vertebra helps to protect your spine. However, I guess when you're going up against someone like Freiza, a single punch could be enough to rupture one of those bones and damage the underlying nervous system. So we're going to need to get an x-ray of Vegeta's back, which often shows up fracture lines or complete destruction of your vertebral bodies. So this is going to cost Vegeta $250, but the further surgery that's required above this is going to be significantly more. Believe it or not, but if you've got a stable fracture of your spine, you don't actually need any surgery, and simple pain relief can be enough. Whereas if you've got an unstable fracture, you're either going to have a vertebroplasty, where you get injections of bone cement into the vertebral bodies to help stabilize them. This often comes in at a cost of around $8,000 to $10,000, or you're going to need to go for a spinal fusion. No, not that kind of fusion. This is a procedure where the affected vertebral bodies have to be fused together using plates and screws. And you're not going to believe this, but it comes in at a cost of over $100,000. Okay, so with repeated elbows to Vegeta's chest and abdomen, we're likely going to be looking at fractures to both his ribs and possibly even his breastbone, otherwise known as his sternum. So let's add on some x-rays and take a look. So here we can see that there are clear fracture lines across these ribs. Now, the danger with this is if those ribs penetrate inwards and puncture the lung. They can cause it to pop almost like a balloon, causing a pneumothorax. Have a look at this x-ray, which demonstrates a pneumothorax, where you can see that the lungs have partially deflated. Now, this would manifest with difficulty with breathing and shortness of breath, and if it got any worse, it could be enough to cause your heart to stop, causing a cardiac arrest. Let's now have a look at what a sternal fracture might look like. So here you can see that the sternum has fractured, forming two different bones. Now remember, your sternum and ribs move when you breathe, so these types of fractures can be incredibly painful. Goodness me, the sound design in this scene makes it seem like every single punch that's thrown there is like a firearm being shot off. To be honest, if it's Freiza that's throwing those punches, it's probably comparable to the feeling of getting shot. But here we can clearly see that Freiza's punching to the side of the spine here, which is where you find the kidneys. So you've clearly got to be worried about damage to those, especially when Vegeta's coughing up blood. Really, if he has damaged his kidneys, he's probably going to be peeing blood too. To know for sure, we'd really need to get an ultrasound of his kidneys, which is going to come in at a cost of around $1,800, and he may well need a CT scan of the kidneys to see the extent of the damage, coming in at around $4,000. Now, if the kidneys are damaged beyond repair, Vegeta might have to consider going on to dialysis, which basically is a machine that takes over the filter function of your kidneys. Now, it's not always used as a permanent option. It can sometimes be used to help bridge someone whilst they're awaiting a kidney transplant. However, if Vegeta does need it, you're looking at an annual cost of over $100,000. Okay, so this scene is really interesting as we see Freiza checking to see whether Vegeta's still able to weight bear on his feet. And this is relevant because he's been repeatedly punching him in the back, and if he's done serious damage to the spinal cord, Vegeta would be paralysed from his waist down. And it looks like from Freiza's assessment that Vegeta's not able to put weight onto his feet, which would suggest that 1, he's paralysed, meaning that he's unable to run away, and 2, he's no longer going to be a threat to Freiza going forward. You see, it's scenes like this in the anime that tell me that the authors had an appreciation of how the human body works.
Good night, sweet prince.
You know, if there's one thing that Goku does really well, then it's his entrances. Whether it's arriving in the Saiyan saga, or arriving on Namek to help save Gohan, he always arrives late, which I guess is better than never. But looking at the medical pod that he was in, it looks like he has a ventilator to help with his breathing, multiple lines which I assume are IV fluids to aid in his recovery, and then it looks like he's being suspended within a liquid, which I assume is just water. I'd imagine that the benefit from being suspended in water is that your body's almost weightless, so it takes off any added pressure that's on your joints or any injuries that you've had. A bit like how you'd feel if you were floating in a swimming pool.
That's right. You heard me. If there's a God, he must be good for letting me live long enough to see this day.
Okay, so it looks like we've got some penetrating chest trauma, and you'd have to assume that Freiza was targeting Vegeta's heart here. But how long would he be able to remain conscious after an injury like this? Well, if we were to compare this to a stab wound, this would lead to severe and rapid blood loss, which is what would cause you to lose consciousness. So I suspect we're looking at seconds and maybe a minute, depending on a few different factors. For example, how quickly he's bleeding out, any specific individual physiological differences that a Saiyan might have, and whether or not any first aid was given at the time of this injury.
Kakarot, please, destroy Freiza. He made me what I am. Stop him, please.
Okay guys, so it looks like Vegeta's total medical bill for the Namek Saga altogether comes up to this staggering number. And that brings his grand total for the series so far to this outrageous number. Now, if you'd like me to do more videos like this, just drop me a character name down in the comments below and I'll definitely check it out. Otherwise, as always, thanks for watching guys, and I'll see you all in the next one. Thanks.